All right, so this is a steroid, and I had seen reports of other steroids in an attempt to maybe revitalize the lungs when they've been attacked and things like this as a potential treatment. Explain why this seems to be working.
Well, theoretically, the way that this works, a significant contributor to the mortality that results from COVID-19 is your own immune system. So your own immune system is overreacting to a pathogen that it's never encountered before. And it causes scientifically what we call the cytokine storm. So that's basically your immune system is throwing everything it can at it. And theoretically, the way a steroid would affect that is to somewhat dampen that immune response, thus limiting the harm that your own body does to itself while you're in the hospital, which when people are ventilated, that's a lot of what's going on. And that's a lot of what they're feeling and why they feel so bad and are sick at that point in time, not necessarily because of the virus, but because of what your own immune system is doing to it. So this dampens that response and allows you to really kind of overcome it yourself without overreacting, I should say.
Now, what this treatment is and isn't. This is not for those that have lost their sense of taste or smell, right? This is only a treatment when you are in the ICU on oxygen.
That's correct. This is, as far as what I gained from the study, this would be for, the most critically ill patients. And this did have, if the study holds up, and again, that was a press release, not a paper. So we haven't really seen the data yet. But if it holds up, and it does come from Oxford, which lends it some credibility kind of already. But if it holds up, what we should see is an increase in the number of people that actually survive the disease. So it's definitely not going to be for, people that are having mild to moderate symptoms and that are home self-treating. This is going to be for your most critically ill patients.
So, Joseph Fair, the capital city in China, Beijing, is now under lockdown again because of another outbreak there. And there are reports that this outbreak might be more contagious than the original outbreak in Wuhan, China. What can you tell us about that in your knowledge as a virologist?
Well, I can't necessarily, point out to the science that says it's more contagious. Beijing has a lot more people than any other city in China. Wuhan already has a striking amount of people itself, but Beijing has, just under 22 million people. There is no option whatsoever to socially distance, having spent a considerable amount of time in Beijing myself. So that combined with the fact that, even in our own experience here in the United States, we see a very significant portion of individuals that are infected that are either asymptomatic or still spreading the virus while they're pre-symptomatic. So it's very reasonable to think that could have occurred between when they declared, the outbreak more or less over in Wuhan and now in cases arriving in Beijing. But it's still a very worrisome development, it being their capital and, how densely populated it is and connected to the rest of the world, frankly.
What do you think that means for what we're going to end up seeing here? There are a number of states that reopened early that are seeing a spike in their cases. There are other states that have had their case numbers fall dramatically. New York is one of them that are starting the process of reopening. And it seems like a lot of local officials, certainly a lot of national officials, are very hesitant to lock down any city again for fear of what it might do, how much worse it might make the economy.
Yeah, I don't think realistically we're going to see another lockdown in the United States. I don't frankly think the American public would accept it at this point. And, I think we'll do a retrospective of why all that is and why it happened that way once this is all over. But I don't think people would stand for it again. What I do think it means is that, I should say that when we've talked about a second wave in the past, we were talking more about a natural second wave, that we would see a dip possibly in the summer and months in the cold and flu season that we naturally see. What Beijing tells us is that they're not seeing that dip. In fact, they're having new outbreaks, and we're seeing that ourselves here. So we're having that same experience, and that we're undergoing a self-induced second wave here in the United States because we just decided to kind of relax our efforts, which were working successfully in a number of states. And so this is really kind of a human behavior-induced second wave that we're seeing.
Joseph Fair, I think you used the word before, endemic at this point. So second wave, endemic, does it really matter? Are we talking... I don't think it matters at this point, to be frank, with the kind of lack of response that we're seeing, even speaking about it in the past tense at certain points in the press conference today, it's kind of like we've already moved on and we're still kind of mid-pandemic. That being said, I think we're going to continue down this same path. I think we are going to either, become develop an endemic kind of situation with the virus itself, or we're going to have a vaccine. I think those are going to be our only two ways out. And, a vaccine is not guaranteed, as I told you this weekend. So, and it's not something that's necessarily going to happen fast. So there are going to be very long-term ramifications to our actions now.
This is why the news on the therapeutics may matter more in the short term than anything else, because we don't know how long that vaccine takes. Joseph Fair, as always, sir, thanks for your expertise. Much appreciated.
Thank you both.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.